This is the causal map that we developed in an earlier segment. A causal map, that is, item 3 in circle 1, tries to map out all the causes of the particular problem we're trying to solve. By contrast, a theory of change tries to isolate those causal chains that we think we can affect through the policy instruments that we have available. This means that we can begin by eliminating certain causes that are not fixable by policy. So, for example, the fact that Bihar is in a rural area with isolated villages and that it is very hard for healthcare workers to reach these places is a fact of physical geography we cannot change. On the other hand, the case talks about a social franchise model that was supposed to affect these elements: the bad training, low prestige, and low pay of rural health providers. So we say the social franchise model will have an effect on these three elements, and once there is improvement in training, prestige, and pay, perhaps it will have a positive effect on this element, distrust. Now, what's interesting about the way this case develops is that the program officer at the foundation back in Seattle picked the social franchise model over other theories of change. For example, the program officer could have said, well, we really want to work on improving the performance of the public sector in improving health services, but he wrote that off as not feasible, apparently because he thought there wouldn't be adequate resources, or that it was impossible to improve capacity. He did think you could improve this one factor, the supply of rural health providers. But if you think about it, that theory of change is pretty complex. The social franchise model had not been established as a workable methodology in other places, and it wasn't clear that it would affect issues like bad training, low prestige, and low pay, and thereby increase the supply of rural health providers. Nor was it clear that an increased supply of RHPs would really alleviate the 4 diseases that were targeted, and finally to improve child health outcomes. The takeaway from this case is that it is important to think through very carefully the theory of change underlying your solution to the problem. It might have been better to test the theory with some prototypes before investing hundreds of millions of dollars in the solution.